Good morning, everyone. This is Gabriella from LAPA-SF, and this week's video is for those of our patients who are heading towards maintenance, and it's about finding ideal body weight, which came up a lot recently, especially in our support groups. So, there is an equation to find out ideal body weight, and specifically it works really well for women, maybe not so much for men. But for women, typically you take 100 pounds for the first 5 feet, and then for every inch after that, you add 5 pounds. So for example, I'm 5'8", so 100 pounds for the first 5 feet, and then for 8 inches after that, so my ideal body weight would be about 140. And then this can be plus or minus 10%. So typically if you have more muscle mass or a bigger frame, maybe your range goes up to like 160, 165. And then maybe if you're smaller, you tend to have a harder time smaller bones or a harder time keeping on weight, then that would be more like 125, 130. So, but a good start is probably about 140. So ideally, when patients want to meet their ideal body weight and trying to figure out in their weight loss phase what weight to go down to, we recommend doing 5 pounds below what they feel comfortable at, assuming that over time you'll gain about 5 pounds. And then also a good thing to do when you're in maintenance is figure out what number you want to keep at and never let yourself go over. So have a range between 5 pounds. So maybe for me, I would want to do anywhere between like 143 and 147. And if anything is going over that, then I would have to monitor my intake more during that time. Many of our patients in maintenance find this good to do because it gives them a target goal and also keeps at that goal. So every day they weigh themselves and they know when they're in those guidelines so that they don't become too comfortable in their weight. And then all of a sudden, 20 pounds later, they don't know what happened. So for men, typically ideal body weight is the same thing, but you do 100 pounds for the first 5 feet, and then 6 pounds for every inch after that. But typically that's a little bit low, and so I usually work with them individually on finding their ideal body weight, and I stick to that. So that is the thoughts on ideal body weight after weight loss surgery, and I don't know if you guys have any thoughts on that. Ideally, too, is that you want to find a weight that you feel comfortable at within the healthy BMI range, and that you're focused on every day that you're choosing foods that are healthy and fueling your bodies, not just for weight loss. All right, so anyone in maintenance have any ideas on that, and they can post that on our Facebook for everyone to read. And then I'll see you guys later this week. All right, bye.